In terms of HIV pathogenesis, we've come a long way. We really understand the mechanisms of CD4 T cell depletion. We understand what leads to AIDS. I think we're at the time now where we are treating people with antiretroviral therapy more and more. So in that context, I think what's important is to understand how the reservoir of HIV-infected cells is established. We know that CD4 T cells are infected. We need to know exactly which CD4 T cell subsets are infected. We need to know which tissues, such as the gut and the lymph node, they're infected in. The reason that we need to understand that is because we are putting people on antiretroviral therapy and beginning to talk more and more about eradication and a functional cure, or a cure, if you want to put it in those terms. In order to purge the reservoir of HIV-infected cells, we need to understand which cells are infected. And that's how I think we should be targeting our activities in the future. In terms of finding the subsets of CD4 T cells that are infected, in terms of the epidemic, again, we're looking at eradication of virus from CD4 T cell reservoirs. If we can get the reservoir of CD4 T cells down to such a degree that we may be able to hold back on antiretroviral drugs, at least that's the hope, then in terms of transmission from one individual to another, that will have a major impact. So I think that's where understanding the reservoir and understanding latency points to in terms of the epidemic.